Reactive Attachment Disorder, commonly referred to as RAD, is a trauma and stress-related disorder most prominently seen in children from neglected home lives or who've spent time in foster care. According to the Diagnostic and Statistical Manual 5th edition DSM-5, RAD is characterized by a pattern of disturbed and developmentally inappropriate attachment behaviors. Many children with RAD exhibit an aversion to touch and physical affection, control issues, anger problems, difficulty showing genuine care and affection, lack of inhibition, absent expression of positive or negative emotions, and an underdeveloped conscience. RAD is often misdiagnosed as some other form of behavior or emotional disorder. Parenting a child with RAD can be incredibly difficult, and outsiders looking in on the family and parenting methods may not fully comprehend the scope of the issues. Parents are often instructed by other family members and friends how to parent these children and are criticized for their parenting. What we know is that normal parenting techniques do not work with radishes, a term coined for children with RAD by the Attachment and Trauma Network, as well as Nancy Thomas Parenting. Many parents affected by RAD feel as if they're at the end of their rope. Nothing works. Often, doctors and therapists are at a loss as well, due to RAD still being a fairly new diagnosis and widespread unfamiliarity with the disorder. The stress RAD can have on parents is very similar to PTSD, and the truth is, those who don't experience it just don't understand. Most parents of radishes report feeling lost or hopeless. Depression, stress-related negative outbursts, anxiety, and emotional breakdowns are all common among RAD parents. But it isn't just the stress induced by the RAD child that causes these symptoms. It's the way parents are treated by society, family, and friends who lack education in and familiarity with reactive attachment disorder. According to the Florida United Methodist Children's Home, approximately 424,000 U.S. children are homed in the foster care system at any given time. As of 2019, over 672,000 children have spent some time in foster care. In a study by Charles H. Zena et al., 94 maltreated toddlers in foster care were studied for signs of RAD during an intake for intervention. Of these toddlers, 38% fulfilled the DSM criteria for a reactive attachment disorder diagnosis. The reason there is such a strong correlation between foster care and RAD is due to the environment, which the child came most prominently between the ages of birth to 3 years old, but can develop in older children as well. Serious social neglect within this age range can significantly impair young children's abilities to relate to others. Features of the disorder generally manifest between 9 months and 5 years of age. According to the revised DSM-4, children with RAD usually have a history of substandard parental care, with disregard for their physical, social, and emotional needs. Often, the children have experienced several changes in caregivers due to loss, foster care, and/or multiple placements. Studies in attachment have been performed by psychologists such as John Bowlby and Mary Ainsworth, which have helped in our understanding of how these disorders develop. Attachment disorders in children can be quite comparable to personality disorders in adults, and often children with RAD can be diagnosed with personality disorders later in life. Think of them as two sides of the same coin. Both attachment disorders and personality disorders develop due to the relationships an individual has when they're young. Both can be explained in part using Erik Erikson's stage theory, which explains that people encounter a series of crises as they develop. For children with RAD, the stage in question is the first of Erikson's stage theory, which involves trust versus mistrust. From birth to about 18 months, infants learn to either trust or not trust their caregivers. This stage is by far the most critical in human development. Think about everything that comes into play when you realize you can't trust someone. Imagine experiencing that at such a young age that you don't know any different. It establishes your view on the world immediately and causes the individual to feel the only one they can trust is themselves. Even though Erikson's stage theory, as well as Bowlby and Ainsworth research in attachment are among the first things psychology students learn, there is still a great deal of unfamiliarity with the disorder in the mental health industry. Most often, those coping with RAD will be referred to specialists. However, the majority of those who specialize in the disorder tend to establish themselves in large metropolitan cities like Chicago and St. Louis. This can make it quite difficult for families residing heading in more rural communities to get the help they so desperately need. This can ultimately lead to families being torn apart by the continued stress of which is usually directed toward the primary caregiver, such as the mother. There are many misconceptions regarding individuals coping with RAD. For most outsiders, children with RAD can exhibit completely normal and even charming behaviors in public, which can lead others to feel the parent is being too hard on their child or overreacting. This is the very same behavior that abusive spouses generally exhibit, and the two are quite similar. The child will even attempt to play one parent against the other. Usually it's the primary caregiver, such as mom, who receives the brunt of the negative interactions, leading to the secondary caregiver, such as dad, to take on more of an outsider's perspective. But it is important to understand that this isn't completely intentional. Because RAD children have negative experiences with their primary caregivers from birth, anyone who takes that role from then on then becomes the original caregiver in the child's mind. This can make it incredibly difficult to connect or form a bond with the child. Human beings develop their sense of morality and conscience by modeling their primary caregivers from a young age. Because of this lack of attachment with a primary caregiver, children with RAD develop a very different sense of right and wrong from the rest of the population. For them, it's all about survival and what benefits them. Because of this, their empathy for others is minimal. According to Kochanska et al., without development of an adequate conscience, children are at risk of developing problems later in life, such as antisocial behaviors, conduct problems, insecure attachment, and psychopathology. Those who aren't familiar with RAD feel that children with the disorder can be treated with medication. While medication can help with neurological chemical imbalances, it cannot change a person's view of the world. Because reactive attachment disorder is more of a social emotional disorder rather than a chemical imbalance in the brain, medication only masks the underlying problem and is temporary. Another misconception about children with RAD is that they can be treated with love and understanding. While all children do in fact need love and understanding to become well-adjusted adults, children with RAD, due to the very nature of their disorder, don't fully comprehend these socio-emotional constructs. As often is the case, the RAD child will view such symbolic expressions as alien. They do their best to mimic them, but don't quite understand them and have the difficult time with continued acceptance of such demonstrations. However, research in attachment therapy has found that regular psychological therapy in combination with 3S parenting style, security, stability, and sensitivity can help. Parents must understand that treatment can't happen overnight. It's an ongoing process which will gradually help both parent and child over the course of years, and you won't see changes immediately. Just as children with RAD need therapy and a 3S parenting style, parents need the same from a professional in the psychological field and 3S style support. Relationships which offer security, stability, and sensitivity without judgment. I performed this research while obtaining my bachelor's in psychology. The references for this research can be found on the screen or in the description below.